If you are suffering from poor sleep, waking up tired, or feeling like you need naps during the day, or you're just not feeling yourself when you wake up, or maybe you have a little bit of brain fog, or you can't think as clearly as you would like to, or like you used to be able to, then myofunctional therapy and breathing retraining might be for you. How do you know that myofunctional therapy would be good for you versus maybe taking some more vitamin D, or getting your hormones checked, or a variety of other things that might be contributing to your poor sleep? Well, you can go get your hormones checked. I highly recommend doing that and making sure that you've got a good levels of all of your vitamins as well. If you're lacking any of those, that is going to inhibit your ability to sleep well. If after you figure out that your hormone levels are within healthy ranges, it might be a good idea to take a look at the rest of this video, where I'm going to review a few things that you can do to check to see if you would benefit from myofunctional therapy. Myofunctional therapy is neurological retraining of the muscles of the mouth and jaw. And we do this in order to keep the throat muscles toned and the tongue in the mouth and not sliding back into the throat, so that when you are sleeping, the throat stays open so that you can breathe easily. What's really cool is that the mouth muscles are directly connected to the throat muscles. They're kind of like heart muscles in that each mouth muscle connects to another muscle before it then connects to bone. And so there are 16 muscles in the tongue. Those connect to the throat, and they also connect to the jaw and wrap around to the spine and the base of the skull. And so as we work on mouth and jaw muscles, we're actually training and toning the throat muscles as well. So if you can do some of these exercises with me, then you'll see whether or not you have control of your mouth muscles, as well as are those muscles toned enough to sustain a position. So I often have people stick their tongue out at me in a point without allowing the tongue to get support from the teeth or lips. So it looks like this. Note that my tongue is pretty still. It's not waving like this. It's not dipping down. I'm pointing it straight ahead. It doesn't look like this. It looks like this. And I can hold it pretty still, and I can hold it there for several seconds. Ideally, you'd be able to hold it for 20 seconds pretty still without it like slowly dipping or slowly raising, right? And then I want to be able to move my tongue from side to side without moving my jaw. So we want to be able to separate the tongue from the jaw like this. Now, if I can do it at that fairly slow rate, I want to be able to do that faster. And then I also want to be able to do it very slow. So I tell kids, slow motion. Can you do this in slow motion? See how far your tongue extends. So as you open your mouth, you're going to raise your tongue to the roof of your mouth without closing your jaw to see how close the tip of your tongue can get to the roof of your mouth without closing that jaw. And it should be pretty close. You want it to be 80% or more to the roof of your mouth without having to close your jaw. If your tongue only raises a little bit, and you cannot raise it without closing your jaw. Right, a lot of people will do that. Make sure you're not closing your jaw to try and get your tongue to the roof of your mouth. So you got to watch your jaw carefully, make sure it's not moving, that is staying fully extended while you're doing that exercise. We want to see if your tongue is being held down by a tongue restriction called a short frenum or ankyloglossia or tongue tie, which is the term a lot of people are hearing these days. Now, if you have a tongue tie, that is one type of tongue restriction, and there is another very important type of tongue restriction that we're going to talk about in just a minute. But just note that that is only one type, and if we fix that, that's great, and it will help with some things, but we want to be able to fix all of them. If you have both, then just fixing one or the other probably won't give you as good of results as if you did fix both. The other type of tongue restriction is a tongue space restriction. Now, what I mean by that is the jaws or the teeth are sitting too narrow as compared to how much space the tongue wants. And so if your tongue has like scalloped edges along it, let's see, I've been pressing my tongue against my teeth to try and see if I could get the tongue to kind of scallop a little bit. Kind of a little bit. There's just little tiny indentations. When you wake up, you might have these indentations of your teeth on your tongue, which is a sign that your tongue is fighting for space. It is trying to fit in the mouth, and it's not fitting very well because it's really narrow in there. And so it's having to fight for a little bit of space back here as well in the throat, and that's not great. So if you have minimal jaw space, or even if you have nice wide jaws, but your teeth are really narrow, then you'll probably see the teeth indentations on your tongue. Another way to check is to check out the some of my other videos where I'm measuring the space in between my teeth, and I've gotten some expansion myself and I felt so much better. A couple of other muscle functions that I check for sometimes are being able to create a tongue suction. See, my tongue is suctioned up to the roof of my mouth, and then I pop it off the roof of my mouth in a loud, crisp pop. If it is sliding off to one side, then it's not very crisp, right? If it's sliding back, if I'm not able to keep my tongue forward, but it slides back, then I'm losing control. I want the whole tongue to suction up to the roof of the mouth and then the whole tongue to pop off all at once. Being able to shape your tongue into a bowl without the help of your lips. So it looks like this. All right, I'm not using my lips to create a taco. No lip support, no teeth support. The tongue ought to be able to do this on its own. And if you cannot, and you've never been able to, we can still train you to do that so that you have better control over those tongue muscles and better tone in those particular muscles. And like I said, there are 16 muscles in the tongue. If you're not able to raise the sides of your tongue while keeping the middle of the tongue lowered, then you don't have as good a control of your transverse and vertical muscles, as well as a few other muscles that help out with that. Also, a couple of other things that I do check for is to see how far back the tongue goes when tracing the roof of the mouth. Can you keep your jaw open and watch your tongue trace the roof of the mouth from front to back? See how I did not need to close my jaw in order to do that? People will show up and they will do this. And by the time they get their tongue all the way back to the back of the mouth, they have to close their jaw in order to reach that. That is another sign of a tongue tie type of restriction. Also, are you able to breathe through your nose day and night? That means while you are watching TV, while you are at work, while you are exercising, while you are sleeping. Most of us know to keep our mouths closed as we're falling asleep, but then throughout the night, does your mouth stay closed? A really easy way to check is to place just a little piece of tape over the lips this way. I never recommend closing the lips all the way with a piece of tape. The mouth is the emergency airway, so I will place a little tape here, and that way I can open up my lips on either side if I need to, and I only recommend that adults do this. I do not recommend that children do this without supervision. An adult can easily take the tape off of his or her mouth, even unconsciously while sleeping. I never had anyone harm themselves by putting a little piece of tape over the lips. It's pretty easy to get that off if needed. And then I only recommend taping the mouth if you can, in fact, breathe through your nose. If it's difficult, really difficult to breathe through your nose, then it's best to practice breathing through your nose during the day with a piece of tape for 30 to 60 minutes every day for about a week. And then if you're feeling like you're getting more and more comfortable with breathing through your nose for that 60 consecutive minutes, then you might be ready to place tape over your lips at night. Now, that doesn't solve any issues. The lips being forced together is not really helping the muscles do what they're supposed to be doing, and the tongue can still slide back into the throat. And so that is why I tend not to recommend mouth tape for kids, and I usually don't recommend it for people who haven't started working with me and started training those muscles first. And after the tongue learns to stay in the right position and has learned what that position is, then I will start suggesting people start taping their lips just to help encourage the muscles to stay together, not to force the person into nasal breathing. We never force anything, especially while we're unconscious. Our bodies will do whatever they need to do in order to breathe well so that you can sleep as best as you can. And if you are blocking off your emergency airway and you need to breathe through your mouth, then you're going to wake up in a fright. And so we don't want to avoid that. So just a little piece of tape covering just enough of the mouth to encourage those lip muscles to stay closed is all I recommend. And then you can try that. And if you wake up with the tape still on your mouth and you do that for a few weeks, then that's great. When I learned to breathe through my nose while exercising, that's when I was able to cut out allergy medications. It was really, really awesome, actually. And I have not needed allergy medication for years now. I got expansion myself, expanded dentally, expanded my palate a little bit, made sure that I had the space for my tongue, did myofunctional therapy during that time so that I could get my tongue tie released and have the space that I needed. And then I was able to continue to do myofunctional therapy to correct my swallow, make sure my tongue was supporting my jaws, make sure it was staying out of the airway and allowing that tube to stay nice and wide so I could get all the air that I needed. And now I can sleep with my mouth closed. I breathe through my nose all night. I breathe through my nose while I'm exercising. I don't have to take allergy medications. I wake up bright and alert. It has been a life changer. I feel like I can take things on now. I can take my life on and take charge of my life. And so I'm loving this so much, which is why I'm sharing it with you, because it was the answer for me. And you do have to kind of figure out what is the answer for you. And if the muscles are not doing what they're supposed to be doing, then this might be one of the things that helps you out. So I hope this helps you find the answers you need, and I will see you later.